Welcome back. Can pancreatic cancer be cured if it is diagnosed in the early stage? That's the topic we are going to discuss today, because most of the patients ask this question. The reason being, pancreatic cancers are a little aggressive, and it's very most of the time the presentation is very late. So the patients are very always curious to know whether it's early stage, it's curable and all. And like any other cancer, pancreatic cancer, the prognosis does not depend on one single factor. It all depends upon the stage of the disease, stage 0 to stage 4. Early the stage, good prognosis. Late stage, prognosis is very bad. So the stage of the disease and the performance status of the patient before the surgery. That means the nutritional status, how healthy they are, their comorbid conditions like diabetes, heart disease, age factor, all these things. When put together, we can, and very importantly, the resectability of the tumor. And the resectability means the tumor is there, we can operate and completely remove the tumor. Sometimes the tumor may be big, but it can be resectable. But tumor can be very small, but we cannot take it out because it is attached to the IVC, blood vessels, so the resectability. The unfortunate thing about the pancreatic cancer is only 15 to 20% of the pancreatic cancers are resectable. So that itself, the prognosis comes very poor. When we talk about prognosis, we are not talking about the cure rate. Prognosis is a good result. So when a doctor says he has a good prognosis, he means 5 years survival rate. After the surgery, the patient will live for 5 years, this much of percentage. So stage 4 unresectable tumors, usually the average life expectancy is only 6 months, we say, and in between we say 3 to 3.5 years, and if it's a very early stage, it's a good prognosis. Again, good prognosis means survival for 5 years is very high. Like any other cancer, even if it is diagnosed in the early stage, it all depends upon how the patient responds to the treatment, responds to the surgery, responds to the chemotherapy and other supportive treatments. So if it is of course a pancreatic tumor, if it is diagnosed in the early stage, the prognosis is good, and if it is diagnosed very late, the prognosis is very poor. Thank you.